So, remember when we talked about the endochondral bone in lecture last week, right? Where do we find our endochondral bone? Dylan, you know you weren't here last time. Huh? Yeah, your skeletal system, right? Your fetal skeleton, right? That's made up of this stuff right here, right?
All of us. All of us.
Our endoskeleton, yeah. Our fetal skeleton, yes, was this, right? All right. All right. You guys like ribs? You guys like to eat ribs? All right. Beef ribs or pork ribs? Pork ribs, yeah. All right. Dry rub or wet rub? Dry? You like dry?
Wet.
I like them both. So.
Yeah.
You guys ever get to the ribs when you come off? All right. You get the ribs and there's that piece of cartilage that's on there. What's that right there? So next time you're at Lucille's someplace, all right, and you're having some ribs, whether they're pork or beef ribs, it's usually the pork ones that'll have them on there, right? And you're chewing on that little, kind of gives you that nice little crunch to it. That's this right here, all right? So if you're ever chewing, like Diego will know, right? So when you have a cow beef, right, and you eat all the meat and the stuff that attaches onto that bone right there, the little short rib, right? That little crunchy, gristly part, that's that right there. Good? All right, everybody feel pretty comfortable with that? Now, you're going to compare this to elastic fiber. The lacunae and everything else is going to be exactly the same, but notice that you see those dark fibers right there? Notice the reason why it's so dark is there's a lot of the elastic fibers. Now, the elastic fibers and collagen fibers are in the last one. They just weren't stained for you. This one actually is stained for you so that you can actually see these guys. This is a longitudinal study. And so, if you think about things that are flexible and stretchy and they bounce back, think about when mom used to grab you by your ear, right? Right. So when she grabs you by the ear and she lets go of it, notice how it bounces back. It doesn't stay in that position. Well, it's because of this cartilage right there. Right? So some of you guys may give your dog pig's ear, right? Anybody give their dog pig ears? Right? That's that stuff right there. Okay. Well, when you give it to them as a pig ear, it's not. It's that stuff that's dried up. All right. All right. Everybody feel pretty comfortable with that one? Which ones are building? Glass are building, right? So remember, cartilage goes from inside out. So the ones in the middle are the blast, so with the larger lacunae, right? And when you get out here towards the periphery, these are the chondrocytes. No, that's a little connective tissue that's connected. That's hanging on to that, right? And that's also based upon your hydration state. If you're dehydrated, your skin will stay up like a tent more than when you're hydrated, right? So I'm a little dehydrated. Taking a while to go back. Everybody feel pretty comfortable with this?
It's dry.
Yeah, it's super dry. All right. All right, which one of you guys started the fire yesterday?
Where was it?
Back by Irvine Lake. And also down Camp Pendleton, there's a fire. Started last night. So I'm going to put some blood on here. Alright, so now the matrix for blood is the plasma, right? That's the liquid portion. The cells are the formed elements, right? Those are referred to as corpuscles. Right? So red and white corpuscles, but most of the time we just call them red blood cells, white blood cells. So notice that the most numerous type of blood cell that you're looking at here are the red blood cells. Okay? And you guys all know the function of red blood cells? Yeah, transport oxygen. What else do they transport? Carbon dioxide. All right. What else do they? What does the what else does the hemoglobin do for you in blood?
Hold on. Wait, what does the hemoglobin do?
Yeah. Besides binding oxygen, besides binding carbon dioxide, they also bind something else that's involved with the chloride shift.
Monoxide.
Well, they have to have iron in order to bind the oxygen.
Monoxide.
Huh?
Monoxide.
Well, they can bind carbon monoxide, but most of us aren't going to be exposed to carbon monoxide. That's a good thing because carbon monoxide has a great hemoglobin has a greater affinity for carbon monoxide than it does for oxygen. So if you suck on carbon monoxide, you're going to be toast pretty soon, right? But remember the chloride shift? Because you have physio, right? Huh? It is an ion that's involved, and it acts in buffering.
Just name ions.
I forgot.
Wait,
I forgot.
where's Sam? Sam, you had phys already, right?
Yeah.
What ion?
Carbonate? Carbonate.
No. Carbonate. Carbonate will act as a buffer in the plasma, but what is the red blood cell buffering with hemoglobin?
HCO3? I forgot.
That's
I
carbonate.
know I've heard of this before, but I don't know what it is.
Huh? Wait, who'd you have for phys? Kara?
Yeah.
Oh shit. Kick your ass, dude. And I know she talked about. I know she harped on you guys about this.
The blood pH buffer system?
Yeah, because I know I talked about it.
Yeah,
But
the-
I mentioned it briefly.
That is carbonate and carbonic acid.
But what is the hemoglobin specifically buffering? Because, alright, so the CO2 diffuses in,
Okay.
right? And it binds with water to form carbonic acid.
Right.
Right? The carbonic acid now gets separated into hydrogen ion and bicarbonate. Okay? The bicarbonate is going to act as a buffer. Right? But the hydrogen ion needs to get buffered.
Acidic.
And the hydrogen ion is what the hemoglobin is actually binding with. Right?
Oh.
And so there's a chloride shift that we'll talk about. You guys remember the chloride shift?
Yeah.
Alright? Alright, so red blood cell. Alright, so we're going to talk about that probably in a month, 3 weeks or so. Alright, so we'll talk about that. Don't scare that you don't know it now. Alright, but for those of you guys that already have phys, you guys should know that. Alright. Did you guys talk about the Haldane effect?
Yeah.
Yeah,
But
kinda.
it's been a long
That's all
time.
right. Yeah. Alright, you don't use it, and you don't use it, you lose it, right? Alright, so